Thank you, Mr. President. My question is to the Minister representing the Minister for Health. Is the Minister aware that World Bank figures show that in the year 2000, Australia had 8 hospital beds for every 1,000 people? That has now fallen to 4 hospital beds per 1,000 people, with the result our hospitals are barely coping, even without a pandemic. If the government insists on rapidly expanding our population for rather questionable economic gains for some, to the detriment of our environment, our community health, why does the government not prioritise the welfare of its own people in another way by massively increasing the quality and capacity of our hospitals and improve our hospital bed rates to match the ratio we had previously?
Minister Symes.
Thank you, President, and I thank Mr Hayes for his question. Just point out that the stats that you've raised, I think, refer to national statistics, but I'm sure that in any event, the Minister for Health and his office will be able to provide some information as a response in accordance with the standing orders.
Mr Hayes on a supplementary.
Thanks, Mr. President, and I thank the Minister for that information. Might be very useful. Minister, we've seen packed emergency departments, ambulance ramping and woeful pandemic response times for some time now. Recent reports from the Alfred Hospital indicate overworked staff, staff shortages, inadequate isolation rooms and safety breaches. It's no surprise to see the AMO strike a note of reality and say that we probably don't have the hospital capacity to open up at an 80% vaccination rate. When will the government start including much more hospital infrastructure and resources into its signature big build strategy?
Mr Symes.
Is it? Thank you, President, and thank you, Mr Hayes, for your supplementary question. I'm more than happy to pass that on to the Minister for Health, but I will pick up on the issues that you raised about our hardworking health professionals and, like you, acknowledge that particularly in pandemic times, the effort that and dedication that our doctors, nurses and hospital staff are to indeed respond to this health emergency is incredible, but also why it's so important for us to continue with restrictions in order to ensure that the hospital staff and system is supported as best as possible to deal with the increasing cases that we're seeing here in Victoria.
Thank you, Ms Grosier.